Hey everybody, Capital 3 Sonography here with our new series, #Draw With Me. Today's edition, Biliary Protocol. This video will walk you through the gallbladder images in both supine and decubitus positions, as well as the common hepatic duct and the common bile duct, showing us how to evaluate the biliary tree by ultrasound. Alright, let's go ahead and get ready to draw. Make sure that you have all the materials that you need. If you want pre-drawn sectors like I have, then you can follow the link in the image or in the video description. That'll take you to a Google Slides and where you can print off the sectors. And you can print those off 1 to a page, 4 to a page, 6, 9 to a page, whatever you want. Otherwise, always feel welcome to draw your own sectors. In our first image here, we can see the gallbladder is nicely extended, centered in our image. Remember that we've already imaged all of the liver surrounding it, so now we can really focus on the gallbladder itself. We will want our focus at or below the area of interest, which is the gallbladder in this case, reducing our depth again to center on the area of interest. We have a nice crisp border all the way around the gallbladder, representing the gallbladder wall. Another structure seen here is the MLF, or main lobar fissure, connecting to the portal vein and the hepatic artery anterior to the portal vein. So let's go ahead and draw our liver. Again, we are just seeing a portion of it. We've already imaged the liver, so now we are really focusing on the gallbladder. We want our gallbladder to be central in our image, showing a nice echogenic wall that should be uniform thickness throughout, really extending the gallbladder neck and fundus into one picture. Again, we should be able to see the MLF, or main lobar fissure, the hepatic artery, and a little bit of the portal vein in this image. If you get lost on how to find this image, remember that all these structures are located in your long right lobe medial picture, and will help you to locate where the MLF is. The gallbladder sits near the duodenum, which we can typically see along the border of the liver. Labeling our picture then, we have the gallbladder, the MLF, the hepatic artery, and the portal vein. Now, as you are getting this picture, remember that duodenum can cause some shadowing. It can also mimic some pathology. That's why we always look at our organs in both longitudinal and transverse planes to make sure that we are truly seeing pathology versus artifact versus other organs in the area. We want to make sure that we're getting all portions of the gallbladder, showing the neck, showing the body, and showing the fundus. This may require more than one picture in the long plane. If this requires more than one picture, you can label the parts that you are visualizing in each section. Moving to a transverse image then, we will want to sweep through the transverse gallbladder, finding an area that represents the gallbladder nicely. We are going to then be looking for, again, a nice wall all the way around, and a logical spot to measure the wall. You can see in our example here, we are measuring on the anterior portion of the gallbladder to get the true accurate measurement of the gallbladder wall. We never want to measure on this posterior side. You can tell that there is some through transmission on the bottom here. You can tell that the borders of the wall are not as crisp. You will get a false measurement on this side. You must measure on the anterior portion. You can choose to do this in the transverse or longitudinal image, and you can choose to do this in supine or the decubitus position. So again, let's go ahead and draw our liver. We have turned our transducer 90 degrees to whatever the long position was for the gallbladder. We'll now see more of a rounded structure representing the gallbladder, again with wall seen uniformly all the way around. We'll most likely see some through transmission represented by brighter echoes posteriorly to the gallbladder. The kidney may be visible in this image with the cortex and the brighter sinus centrally. Labeling our picture, then again, we have the gallbladder in transverse, surrounded by liver. The right kidney may be visible. This image, again, will be an option for you to measure. Remember that when you measure, you must measure on the anterior portion, typically best at the liver-gallbladder interface. You never want to measure on the posterior side of the gallbladder. Remember to stay perpendicular to the wall. Once you've completed looking at the gallbladder in the supine position, you are going to ask your patient to roll onto their side. When I am scanning a patient, I typically just ask them to roll away from me, but this will put them up on their left side in the decubitus position. We now change our labeling to say long gallbladder LLD, which stands for left lateral decubitus, meaning the patient is laying on their side. When the patient rolls, the fundus of the gallbladder will become dependent, meaning it's going to kind of flop over towards the patient's left. We are going to remain in the longitudinal and transverse positioning as if they were laying supine, but now they are rolled up onto their side, and we are going to reevaluate the gallbladder. The reason for this is to evaluate for any mobile structures within the gallbladder. Mobile structures include gallstones or sludge. So let's go ahead and draw our liver. Remember, the patient is rolled onto their left side, so the gallbladder fundus will be flopped more towards the patient's left side. This typically makes it a little bit easier to elongate the gallbladder than it is in the supine position. Make sure you are elongating from neck to fundus. You may require multiple pictures to be able to image all of the gallbladder in longitudinal. Typically, again, there is through transmission and shadowing from the nearby bowel and duodenum. The gallbladder, again, is seen flopped over. Anterior to this is the liver. Bowel will be seen again in this position. And this is a nice way, again, to evaluate, are there any mobile structures within the gallbladder, and to differentiate bowel from internal gallbladder contents. After elongating the gallbladder in the LLD position, again, we will take a transverse image. Remember again that the gallbladder has kind of fallen more dependently, which is typically a little bit further outside of the liver. Sometimes this makes it easier to visualize the gallbladder in its entirety. Here we have the transverse gallbladder, again labeled in the LLD annotation. We can see that it's taken on a little bit more of a triangular shape, but it is still much rounder, or obviously in the short axis compared to our previous picture that was in the long axis. Let's go ahead and draw a little bit of the liver that we can see off to the left-hand side of our screen. Next to this, we see the gallbladder in the short axis with clear walls surrounding. And in this image, we can actually see a little bit of the stomach. We can see the different layers of the stomach, alternating hypoechoic and hyperechoic, as well as the rough internal surface of the stomach called the rugae. Labeling our picture, again, we have the liver, the gallbladder, and the stomach. Now, the stomach is not always going to be in your images, but you should be aware of relational anatomy, so you know that this is not a random structure or concerning structure in the midline abdomen. You can also choose to measure at this point, again, choosing to measure upon the anterior border of the gallbladder, typically measuring at the gallbladder liver interface to get the most accurate. Moving on, then, we're going to take a look at the common hepatic duct and the common bile duct. Remember that the common hepatic duct is still considered inside the liver, so we want to visualize the porta hepatis, which typically, if you take a line, an imaginary line connecting liver tissue over the porta hepatis and back to liver tissue, you will have an imaginary line as to which you can then determine inside the liver is common hepatic duct, where outside of the liver is common bile duct. Now you are oftentimes able to get both the common hepatic duct and the proximal common bile duct in one image. You may measure the common hepatic duct and the common bile duct off of this one image, making sure to change your labels in between. However, many students opt to focus on just the common hepatic duct for their CHD picture and then reposition the probe and re-image the common bile duct, focusing on that distal portion. So let's go ahead and draw a little bit of the liver that we are seeing. Again, we've already imaged the liver, so we want to make sure that we are zooming in on the common hepatic duct, on the common bile duct, making sure that we are evaluating this area thoroughly for any stones, any blockages, anything abnormal. Quite often the gallbladder will be seen in this image as it connects to the common hepatic duct via the cystic duct. And we can see a gap in the liver tissue, creating the porta hepatis. At the porta hepatis, we know that the portal triad transverses this area, with the portal vein showing segmentally here with thicker, brighter walls. We can also see then the duct coursing from inside the liver to outside of the liver, making the internal part the common hepatic duct and the external portion the common bile duct. You can see again bright white walls, and the third component, the hepatic artery at the porta hepatis. Labeling our picture, then we have the liver and the gallbladder. And in the porta hepatis, again, we are seeing the portal vein segmentally here, the hepatic artery, the common hepatic duct on the liver side of the porta hepatis, and the common bile duct on the medial portion. Now it's going to be very important that you recognize where that porta hepatis is so you accurately are identifying the common hepatic duct versus the common bile duct. If you opt to put color on in this picture, what you'll typically see then is the portal vein, the hepatic and the hepatic artery with the same identification of color flow, typically red, indicating blood flow into the liver. This will help you differentiate your hepatic artery from your bile duct. To further exemplify the common hepatic duct, I have a second image here showing that you can obtain the common hepatic duct and the common bile duct from different views of the body. It depends on the patient's anatomy. Sometimes you will see other structures in this picture. Sometimes you will need to have your transducer in various positions. So again, here I am drawing the liver. The gallbladder is often seen in this picture since we are in that area. We can see a gap in the liver tissue creating porta hepatis. We can also see the IVC though in this image as well. It is not uncommon for new scanners to confuse the IVC with the gallbladder. You can see their proximity in this picture. We're again seeing the portal vein in a segmental fashion here, and we can see a linear structure anterior to the portal vein representing the common hepatic duct because we are internal. Labeling our image, then again we have the gallbladder, the IVC, the liver, portal vein, and the common hepatic duct. In this example, we are only seeing the common hepatic duct. We are not seeing any of the common bile duct beyond the porta hepatis. Again, if a person decides to put color on in this picture, we will again see flow towards the liver, usually represented as red in the portal vein, and blue flow within the IVC, leaving both the gallbladder and the common hepatic duct anechoic. We then can measure the common hepatic duct perpendicular from inside wall to inside wall, making sure that we're staying on the liver side of the porta hepatis. In this example, we are moving then to the common bile duct. We can still see the common hepatic duct in this image, but we are now measuring outside of the liver, which indicates the common bile duct. So again, drawing the liver, creating that gap that represents the porta hepatis. We can see bowel or duodenum in this image, which is not uncommon, often obscures some of our visualization of the common bile duct and pancreas head. We can see the portal vein with the bright white walls. We can see the common hepatic artery in the cross section, and then we will see a linear structure representing the common hepatic duct and the common bile duct. In this image, we are focusing on the common bile duct, so we are looking for the area outside of the liver, following that invisible porta hepatis line. Remembering that bowel can sometimes be in our way, we want to use windows that allow us to see as much as possible. The portal vein will always be posterior to the common bile duct. The hepatic artery is typically in cross section or short segment of it. And again, we can see the common hepatic duct and the common bile duct. Now, when you're taking this picture, you can have your patient in the supine position or rolled in the LLD position. If you're struggling in one position, make sure to try another position, as it might become more obvious as the bowel and other abdominal contents move. Again, we want to zoom in on this picture and use color to prove that we are indeed looking at a duct. Once color is on, the duct is typically left anechoic, and then we can measure the duct from inner wall to inner wall, making sure that we are perpendicular through the duct. In this last example of our biliary tree, we can see that the sonographer has zoomed in on the bile duct. They have used color and they have measured. You always want to make sure that you use your color to differentiate vascular structures versus non-vascular structures, such as the ducts at the midline portion of the body. When you are measuring, then you always want to make sure that you're measuring inside to inside of the duct wall, making sure again that you are perpendicular to the walls and to the coursing of the duct. You will want to make sure that you are rotating your transducer in different ways to elongate the duct as much as possible, because it will vary from patient to patient how your transducer is typically positioned. You're most likely going to be more in a longitudinal position with your transducer, with a slight oblique to it, which is represented well by this image, in which we can only see part of the IVC and part of the portal vein. The sonographer has elongated the bile duct out, where we can see both the common hepatic duct and the common bile duct. We can clearly see where the porta hepatis is, represented by the gap in the liver tissue, where the portal vein and bile duct cross over. So again, we can see the liver, an oblique view of the IVC, a portion of the portal vein, and the common hepatic duct and the common bile duct. Looking for the porta hepatis to differentiate where the common hepatic duct ends and the common bile duct starts. Your IVC and ducts, again, and portal vein will be anechoic. Typically, our color box will be on during this image, showing blood flow in the vessels such as the IVC and the portal vein. You can then measure your common bile duct or your common hepatic duct in this image, again staying inner to inner. So to recap, we have our patient begin in the supine position, where we elongate the gallbladder. There is no true long or true trans in imaging the gallbladder. You want to position your transducer to wherever you are long to the organ. Once you have established what the long position is, you will take representative images of the gallbladder in the longitudinal plane and then turn your probe 90 degrees to obtain the transverse images while the patient is supine. You then will roll your patient into the LLD position onto their left side facing away from you, and you will again establish the long to the organ picture depending on how the gallbladder has moved within the abdominal cavity. You'll then again change your transducer 90 degrees to your longitudinal picture to obtain the transverse views. You will want to choose then at some point during these 4 pictures where you saw the wall best, where it would be best represented through a measurement to show a correct representative measurement of the gallbladder wall, making sure to always measure on the anterior portion, typically at the gallbladder wall and liver interface. Once you've imaged the gallbladder in both supine and decubitus positions, you will also want to evaluate the ducts as they are inside the liver, creating the common hepatic duct, and as they are outside of the liver, creating the common bile duct. Identify where the porta hepatis is by looking for the break in the liver tissue. Use your color to differentiate vessels and ducts. Zoom in on your image, and then obtain pictures with and without measurements, measuring inner to inner on the common hepatic duct and inner to inner on the common bile duct, showing elongated images of both.